Vice President, Madame Pillay, representative of government, distinguished colleagues. I speak on behalf of the World Health Organization, UNFPA, UNICEF, and the colleague from the Partnership for Maternal, Newborn and Child Health, because on this topic, as UN, we are working as one for quite some time, and we call ourselves H4+, which is about the chemistry in the UN. And I first would like to thank very much the organizers, especially the government of Colombia, Burkina Faso, and New Zealand, not only for organizing this special session today, but for their leadership in pursuing that this issue of maternal mortality be placed to the Human Rights Council agenda and continue to be discussed through resolutions, including the one that is upcoming. Let me add to what has been said already, some good news to begin with. If we look at the progress in reducing maternal deaths since 1990, which is the beginning of our target for MDGs, we see that indeed there has been a 1/3 reduction. So we are now at our latest estimates from 2010, around 350,000 women that still lose their life. So the world has seen some significant progress, and as Ms. Pillay has highlighted, we have knowledge, significant knowledge on how this has been achieved and what the best practices are. However, as other panelists have highlighted, the progress is not yet enough. And it's not enough to reach that target to which many presidents from your own countries and my own country have committed to. So some of the key factors that have allowed that progress to happen include broader social changes and the empowerment of women in terms of the law and the regulation that allows them increased use of contraception and delayed childbearing. Clearly very, very important, increase access to health services and nutrition, as the Vice President has highlighted in Colombia, and then the prevention of management of a safe abortion, which still constitutes a quite clear reason for women to lose their life, and especially the most vulnerable women, as has been highlighted. As we have discussed partly last year and also during this year, the Secretary General has recognized the importance of this goal for broader development and from the human rights perspective, and last year launched what he called the Global Strategy for Women and Children Health, which is a global pathway for countries to make further progress in reducing maternal and child mortality and improving nutrition. And as of today, more than 61 governments, 16 foundations, 7 multilateral organizations, 22 NGO, and 14 private sector companies, very large ones, have made concrete commitments to implement this strategy. So we are seeing an unprecedented multi-stakeholder effort that is unfolding in our eyes. And we are informed and excited that next week, at the time of the General Assembly, at the special event that the Secretary General will host that is entitled Every Woman, Every Child, some new commitments will come, and some significant commitments, again, from other governments, from other private sector companies. So we need to continue to sustain and maintain this effort that we are witnessing. On the other hand, the Secretary General also to ensure that these commitments do not remain a letter or do not remain a speech the heads of state pronounce when they go to New York, has also asked us at WHO to create a process that really looks at how do we maintain accountability for these promises, how do we ensure that promises are kept and that results are achieved with those resources that are committed. And we have done so with the help of many partners through the establishment of what we call the Commission on Information and Accountability for Women and Children Health. This commission was at a very, very short and targeted work. It has been chaired by the Prime Minister of Canada and the President of Tanzania. It was composed by high-level representatives, several ministers, some of justice, some of health, some of information, and representatives from NGO, prominent NGOs, and private sector and academics. And it's just concluded this work. Its report will be presented next week to the Secretary General, And we have copies of the advance report at the back of the room for everybody to see. But what I wanted to highlight for the audience today is that the recommendation that this commission have come and the work of the commission is really being grounded on the human rights principle. And it has suggested a framework for accountability that is really emerging from the human rights principle. And this framework begins with monitoring, looks at and reviewing what the progress has been, and then suggests ways of creating remedial action when those actions are needed. The Commission has also recommended the establishment of an independent expert review group that will report to the Secretary General from 2012 to 2015 every year on the progress that has been made, on the commitments, on the financial resources that were promised, and on the results that are being achieved. And I'm glad to say that also this recommendation, again, to indicate that these are not just recommendations that will remain on paper, but the Secretary General will be able to announce the composition of this independent expert review group at the same time as the two heads of state announce the recommendation, so that action is taken right away, because in these days, with this short deadline we have 5 years to the target, we really want to show that things are happening. So the opportunities that are here are clearly very important ahead of us. We, from the UN, as I said, as one, warmly welcome the effort that the Human Rights Council has made to advance this agenda and the resolution that have passed. We also very much welcome the report that Ms. Pillai has presented, and we look at how can we work with you and other governments to ensure that those best practices are adopted. It is now time for those actions to be really taken in countries where we can save the life of women and their children that are at risk. So the principle of the framework for accountability, as I said, are really grounded on the human rights principle. And in implementing those recommendations, which among others include also, for example, the very important vital registration of birth and death, because one of the key weaknesses for countries that still have high maternal morbidity and mortality is that the information system is very weak. So we do not really have the right information and the timely information that we need for their access. But the principle of implementing the recommendation will definitely be based on the principle of equality and non-discrimination. And for example, it will require special attention on the needs of a especially vulnerable population, like indigenous population that the Vice President has highlighted from Colombia experience, and also adolescents that, as you rightly said, are more vulnerable. We also look at applying systematically the principle of participation and empowerment, and therefore the need for information to women about their own rights and what they can expect and demand from their government is clearly important. And the Commission recommendation also highlights national accountability mechanism to be strengthened, to build on the accountability mechanisms that already exist in countries, but to be strengthened. And here is where I think the national human rights institutions have a crucial role to play into the strengthening accountability at the country, at the domestic level, as well as parliaments and civil society actors have a very important role to play. So these are just some illustration of the rapid progress that we are making this year, and then with the help of all the committed governments and other partners, we can really expect and demand to have faster. And just to allow me to conclude, to say that we remain at your disposal, at the disposal of the Human Rights Council, to work with you in close collaboration in the next steps on what is being demanded on the resolution that is being discussed, to pool our expertise that we have from the all-UN group and the Partnership for Maternal, Newborn and Child Health, to provide the knowledge, the evidence, the science that we can. And we are delighted that since the beginning of the summer we have established a collaboration with Professor Paul Hunt, former rapporteur on health and human rights, that will help and inform our work to really have a strong human rights approach and lens. And thank
very much, Dr. Estrella.